Well, all right, we're back with Dr. Limongelli from Yonkers, a dentist. Dr. Limongelli, we talked about missing teeth and how important it is to replace them because otherwise your face goes out wacko and it just is hurting the body overall. So give me some of the major treatments which are available to fix missing teeth, because I'm sure there's several. I'm sure there's some cost, some are cheaper, some are more expensive. Talk a little bit about it, please.
All right. Probably the most effective and the best way of doing it is with implants, provided there's enough bone for the implants to be placed. This affords the patient permanent replacement of the missing teeth without touching the adjacent teeth at all. The second best way is with permanent replacements by means of bridges. Bridges are made by putting caps on the adjacent teeth, and a dummy tooth, or a pontic as it's called, is the replacement of the missing tooth. It's all one piece. It's permanently cemented in the patient's mouth, and it's pretty much like having your own teeth back. The third way is the most economical way in terms of cost, and that's by a removable replacement. Removable partial dentures essentially hook onto the adjacent teeth and can be removed, cleaned, and put back in the mouth. These are usually taken out at bedtime and thereby the mouth given a rest over the evening. Those are the three most popular ways of doing it.
Okay, let's talk a little bit about some, obviously the implant is kind of the most expensive one, and I guess that's like an iron rod, a titanic rod, is put into the bone, and then a tooth goes on it, and a bridge, and that one apparently lasts the longest. It has the longest expectancy of not breaking anymore. Is that true?
It is. The implants these days have about a 98% success rate. And the endosseous implants are the ones that screw into the bone, as you mentioned. They're usually made of titanium, which is the same material they make the joint replacements for in the body. Very durable, very strong, and they do last a long time. But there are indications and contraindications for them. The most important one being that the patient doesn't have any systemic diseases that will be detrimental to the take of the implant.
Okay, that's some systemic diseases could prevent him from doing it.
That's correct.
Okay, they would be what would they be?
Such as diabetes, for instance, which attacks the microcirculation, and those patients don't do very well with implants. The second contraindication, and the most important really, is smokers. Implants are contraindicated in patients that smoke. Those that are interested in it have to give up smoking. Otherwise, the implants will fail. I've seen patients, after a couple of years, all the implants loosen up and come out, and that's a tremendous loss in investment. These implants are quite expensive.
Right. Now, I heard that, and I think it was you who told me in another video, that when an implant goes in, it kind of replaces the root of the tooth, so to say, and it keeps the bone strong and not shrinking. So to that degree, implants apparently are better than any partial, even a crown, which still leaves that space in the bone hollow, and that part of the bone, the jawbone, could possibly and will most likely shrink. Is that true?
That is absolutely correct. Yes.
And if there is too many teeth missing, meaning you have lots of bridges or partial dentures basically, or dentures period, and don't have those implants stuck into the into the bones, then your jaw will cave in, and you start looking caved in, basically start looking like a dried out pumpkin, look ugly. Yes.
And that's an extreme case, but that can happen, yes.
Well, I mean, you see, I mean, I remember my grandma, I mean, you know, there was no implants when she had lost her teeth, you know, she's, you know, rest in peace already for a bunch of years, and she died at 90 and whatever, 3. But the point is that, you know, there was no implant, so her, you know, obviously it started caving in, and she started looking very hollow, and apparently that's what all people start doing who have teeth missing and not replaced by an implant, which seems to be the only thing preventing it, except, of course, keeping your own teeth.
True. The implants do preserve the bone and prevent that.
Wonderful. So it looks to me like a dentist putting an implant, not only do you feel good, can bite good, and all that type of stuff associated with having a good-looking mouth, like Julia Robertson or Tom Cruise, but at the same token, and being able to chew and all that proper. At the same token, it seems to be that you guys are, you know, like they make you look good, the best plastic surgeon in town.
Implants are very effective. And,
well,
very much.
Well, all right. Okay, good. Well, appreciate you letting us know about that, and we'll be back with more videos on periodontal disease and other stuff, and what is the real danger there. And to just give a hint, from what you told me, doesn't seem to be the tooth loss. It seems to be something else. So speak to you soon.
Very good. Bye.